Okay, so if you were not here yesterday, my name is Veronicah Mwaniki, Program Officer, Economic Empowerment Programs. And I'm here with my colleagues from NJOR, Claire Balani, Patrick Oyulo, Asia Walker, and Pauline Barnes. So let's jump into the topic for the day. So our agenda for today, we are going to look at data capture guidance. What kind of data should we capture? And just to put it in perspective, we are looking at client track data. I know we all have different databases that we use, but we will be talking in the context of client track. And again, a disclaimer, today we are not looking at how to do things, right? We're not looking at how to pull data, how to do the workflows. No, today we are looking on the softer side of data and looking at the why. Why are we doing this? How is data important to us? So just to put that out there. And if you have any questions on the how, we will get to that because we will be sharing a calendar of trainings that the data team will be carrying on throughout the financial year. And then we're going to look at data quality and different aspects of data quality, the different elements that comprise that. Conducting quality assurance of data and using data for program success. And we will have a closing activity that we can work on together. So jumping onto the first slide here, just like yesterday, we used Slido a lot of times. So kindly scan the code and give your responses on how you would rate your comfort using client track. Nice. I see a lot of people on 4. That's good. 5s are coming in, which is great. And it doesn't matter. This is not a judgment call. This is where I am. And that's okay. We still have the trainings that would help to bring up your level if you're, at a 1 or a 2, or, there are people who just started working yesterday, so maybe they don't even know what client track is yet. So that's fine. Okay. So I guess most people are doing really well. We have an average score of 4.0, which is good. We have a few experts, so we have trainers of trainers. I hope they are spread out across all the agencies. Okay, so we are going to move on to the next slide and get into data points that are captured on client track. So the first and most important thing is the core demographics. So we are looking at how we capture our names, for example, the immigration status of our clients, the date of birth, the states, the cities that they live in, the zip codes, like the core demographics, it gives us an overview of who we are serving. If I can be able to look at the core demographics of any data, I can be able to know how many male, how many female, how many people live in what county, how are the caseloads looking spread out across the state. We will be able to get that from our core demographics. Then we look at program and project enrollments. We have different programs that we run. We have the RCA program, RSS programs, school impact, youth mentoring, financial capabilities, career pathways. So having those program enrollment dates is very important because then we get to know which client is enrolled in what program and how many clients and how many programs are people being able to access across the board. So under program and project enrollments, we are capturing entry dates or start dates and exit dates. Exit dates are very important because we will get a true caseload. Sometimes we have people on the program for very long and they haven't had an exit date, they're not receiving any services. So that skews the numbers. So it's important to have the program start dates and the program end dates, always put it on client track. then what services are they receiving under the programs, right? So maybe if they're receiving cash assistance, are we doing an FSSP? Are we doing a budget? All the services that are specified under each program, then we need to make sure that we document that on Client Track. And again, this speaks to how many services we're able to provide. At the end of the day, the data we collect is used for different purposes, and that's how we're going to see the effectiveness of how we collect the data and how we're able to make changes in our programming because of the data that we collect. And under the program specific, they are required, under the programs, there are specific required data fields. For example, if, like I mentioned earlier, if it's a program like RCA, we need to know what are the start dates, what are the end dates, what's their, now RCA is 12 months, what's their 365th day, for example. If someone is enrolled in employment, you want to know, do they get a job? What type of cash assistance are they receiving when they get a job? How much are they getting paid per hour, for example? Are they working full-time or part-time? Are they getting health benefits? If they've been working for a couple of months, 3 months, have you done the retention check? So there are program-specific data fields that need to get entered at all times. Then, of course, we have the case notes. I think we all say that if it's not case noted, then it did not happen. And so the case notes are the ones which tell us the story of what's going on with the client. So it's like a flow of a story. The client came in, we did an assessment, these are the gaps they have, and and this is what we're doing about it. So the case note, I see it as a story that when I read through it, I'm able to see all the services the client has been able to access, all the barriers that have been worked on, and where the client is from the beginning to the end. Then program referrals, and this ties down to what we do under the FSSP, which is a program service that is required. So once you identify the goals, how many of those goals can you be able to meet internally as an agency, and how many are you referring out? So once you refer clients and you document that, it's important for us to know, then we get to know which other partners are we working with around the state or even internally as an agency. And I will move on from there. And the importance of capturing the data and doing an analysis. First is to capture the impact of the program. Many times we are saying we have reached this number of people. For example, if you were in the meeting yesterday, when Kathy spoke and gave her numbers, we're able to see the impact of what we are doing. Sometimes we are looking at what we are doing as an agency, but when we capture data on Client Track and we're able to get the whole state data, we're able to see an overview picture of what's going on. We're able to see what are the trends, who are the main people that are coming in terms of immigration status, what programs are people getting enrolled in, what services are they receiving. So what is the impact of our program? That we can be able to get that when we put the data on Client Track. Then we identify areas for refining and improving program quality. So if you're looking at a program and saying that our goal for this year maybe was to reach 1,000 clients in job placement, but at this time, this is where we are. We are reaching maybe 500, for example. So how can we improve the quality of our programming? How can we improve our outcomes? So we are looking at what are the barriers that these clients are facing. That would be in the FSSP. Then we can look at, these are all the barriers. Most people are having, for example, low proficiency in English. So how do we then beef up our ESL, ELT programs to make sure that they are meeting that need to increase the quality of our programming? And then we increase accountability. Of course, data is what we use for reporting. We always come to you for data. We are asking for data in the ORR 6, in your narratives. We ask for ASPs and AOGPs. All that information is used to report back to ORR. Yeah, and at an agency level, I'm sure you have your own internal mechanisms of reporting to your maybe headquarters, or the data is used for fundraising. So it creates accountability. This is how much you are given to do your job, and this is how much you have achieved. We're able to get success stories that we can share with donors and other stakeholders, and that way we increase our funding levels. Another importance of data capture and analysis, it informs critical and strategic choices. So for example, when all of a sudden we had an influx of the APA, the Ukrainians coming in, the numbers are the ones that would be able to help us know, okay, we need to increase staffing. If the numbers were not captured anywhere and we're just talking in abstract, or we have a large number of people, if we can quantify the large number of people and what that means in terms of caseload per caseworker, then we can say, okay, we need to spread out. We need to make other strategic choices. How do we open another office to reach do we open a satellite office, for example, to be able to reach our clients because maybe they are traveling too far from us, or things like that. We're able to make choices because of the information that is captured and how it is analyzed. And the most important part of all this is that they may look like they are high level when you talk about impact and accountability and program quality, but you are all part of the process because it all begins with the person who's entering the day-to-day data before it can come up. For data, we say whatever you put in is what you get out. So if everybody's putting in their data correctly, then what we are going to be able to capture and analyze is going to make sense when you're looking at the importance of the data. So we're going to talk about how to use program reports, because at the end of the day, when the data is put in, and maybe some of you have had experience with this, there are reports that are run. And the reports are the ones which give us an overview of what's going on. So like we have the biggest report that we do is the ORR 5 that has all the programs, all the clients and the programs that they are receiving. So at supervisor and manager level, we are using the data to evaluate program outcomes, right? We are looking at this is what we set for ourselves at the beginning of the year, and this is where we are. What do we need to change to become better at what we're doing? Or if you're good, we're good. What are we doing good that we can share with others as best practices that we've been able to reach our goals? Supervisors can use reports for caseload management. So we are looking at this is how big our caseload is, this is how many people, caseworkers I have, and how do I spread the caseload across the team to make sure that nobody is doing more than the other. The supervisors are again using data for quality assurance, and gathering data for external presentations. If anyone is going for an external presentation to the donor, to other stakeholders, to potential fundraising activities, it is this data that the reports that they're going to pull that are going to be able to help them make the presentation worthwhile. They can be used in team meetings. So when you're having your team weekly team meetings or bi-weekly team meetings, you're highlighting that this is what I'm seeing from the reports. This is the gaps that I'm seeing on the report or on the data, and how do we meet those gaps? You're using the team meetings to evaluate maybe even the strengths of your team. So maybe when you're having your one-on-one check-ins with your caseworkers, you can be able to say, there's a problem here, or I'm seeing a data lag in this place. How can I help you with training? You're looking at how you can build your teams using the data that you're receiving from the programs, and how you can help them to meet the gaps that they may have. And then, of course, for grant report writing, we talked about fundraising. It's important that we are able to use data to write our grants, because every grant, you have to have a reason and a purpose, for example. And the purpose will come from the data. We can say we need more funding because this is where we are, these are the outcomes we have achieved, and this is where we want to be. So that will help the grant development teams to work to do their grants. Then when it comes to direct service members, again, caseload management, you can be able to see how much people that you're working with, how many people you have on your caseload. And so when you're having a conversation with your supervisor, you can say, these are the number of people that I'm serving. Maybe I feel like I have way too many, I'm not able to handle. Then you can be able to have a discussion around that. Again, quality assurance is part of the process. You can be able to look at your own data and say, okay, and this is because I know as direct service members, sometimes we use maybe interns for data input, some administrative tasks. So you're looking at your data and seeing, oh, I see that the way they're putting in maybe the employment numbers is not correct. Maybe the way they're putting the hourly wage, or it just looks off, or something. When you're able to catch the quality issues in your data, you're able to correct that. And of course, to manage the program or the project that you're implementing. And talking about data quality more in depth, I asked the question, who is responsible for data quality? And I would say all of us, everybody has a place and a part to play when it comes to data quality. It is not left for a certain people, supervisors, or whoever. Everybody has, whoever is putting in the data, whoever is pulling out the reports, whoever is doing if you have data specialists that are just looking at the quality of the reports, everybody has a role to play when it comes to the quality of the data that is being produced. And when you're talking about quality, there are different things that you look for. So first of all, the timeliness of the data that you're providing. So if you did an intake today and then recorded it maybe 2 months later, I think we can all agree that it's not timely, right? There are many services that could have happened from the intake date and the enrollment to you putting the data 2 months in that you're not capturing. So we want to see the timeliness of the data. If you're seeing clients today, it would be advisable that maybe in the next 24 hours or whatever parameter you put for yourself to make sure that you don't have a backlog of information that's not been clocked in client track or whichever database that you're using is very important. One is that we forget. If you're doing services and you're not logging them on time, the likeliness of forgetting it's really likely. And then secondly, even if you remember, you may not remember all the details and you might not remember the timelines. So I think trying to make sure that we prioritize making sure that the data has been put in and put in on time is very important. Then we think about the uniqueness of the data that you're providing. So the data is unique because there are people that have we use alien numbers, for example, for our clients. So how unique is that data? We are looking at, if you find that the data is, you find 2 people have the same alien number, then you know there's an error there. You're looking at maybe the date of birth and comparing to the exemptions that are provided. Do they match, right? You're looking at, again, date of birth and the programs that people are enrolled in. We know the school impact, we enroll the children, and the RSS programs and RCA, we enroll adults 18, anyone that's above 18. So you're looking at that uniqueness of the data to make sure that it is captured properly and to review that it is done well. Then the completeness of the data. Sometimes we get data, but it has a lot of blanks, right? A zip code is missing, a county is missing. And most times alien numbers are not missing, but there's always missing data. Maybe a client is enrolled in a program, but the enrollment date is missing. A client got a job, but the placement is missing. Or if it's there, it's not complete in that there's a job placement. It says they started a job on this day. It doesn't say whether it was full-time or part-time. Doesn't say how much they're earning. There's a lot of missing data, especially when it comes to hourly wages. And I understand sometimes clients do not want to share that, but it's part of the process and part of the compliance that we need to know. If you have a job, how much are you earning? Because at the end of the day, it is how much you're earning by providing your pay stubs to us that let us know whether you're self-sufficient or not, because that goes back to your budget. And so it's a whole conversation. When you provide your pay stub, you're able to look at your budget, you're able to say, okay, this person is self-sufficient, so we need maybe to cut them off from RCA, or we need to reduce the amount they're getting in RCA, for example. How accurate is the data? Those are things that we need to be reviewing when looking at data quality. How consistent is the data, right? We know that there are people that our RSS programs, RC and RSS, we can only serve clients for up to 5 years, right? So if someone is in the program for over 5 years and they don't have an exit date, how consistent is that? and what does it say about our programs and what we are doing? We may be saying we have a large caseload, but is it that we need to go back and revisit the data that we have and look at how consistent it is, whether it is in line with the program requirements, and maybe close out people? And then the validity of the data has to be valid. For example, if someone is an SIV, we know that if you're an SIV, you most probably your nationality would be Afghan or Iraq, right? So if you're having an SIV person on the immigration status column in your data, but then the nationality is some other country, then you know that that data is not valid. Moving on about data quality assurance and the things to look out for when you're doing data quality assurance. Incorrect and inconsistent spelling of names. So sometimes we have data that shows incorrect spellings of names, but then maybe inconsistent. So if it's a family, a family that you're enrolling into client track, and there are different spellings of the last name, then you're not sure what exactly is the correct spelling of that last name. So making sure that we have consistent data. Duplicate entries. Sometimes we have clients that are in duplicate, or they're in duplicate programs. So when we pull the data, we have a lot of duplicate entries of clients, and then there's a lot of cleaning up that has to go into that to make sure that the data is quality. And we talked about missing or incomplete information. It could be demographics or the services or program enrollment dates. Inconsistent dates. When service delivery is recorded prior to enrollment. So we have someone who has an FSSP on one date, but no enrollment date, for example. Then you're wondering, how do they not have an enrollment date, but they have an FSSP on record? Or using future dates. And I know sometimes it's a typo, not even future, even like archaic dates. Sometimes I've seen dates with 1900, for example, for an exit date. And you're like, okay, it must have been an error, but it's good to make sure that that is consistent. Mismatched data. So nationality is not matching. Like I gave the example of the SIV who is not from Iraq or Afghan. So the nationality is not matching the immigration status, or the program enrollments are not matching the immigration status. Significant delays between service delivery and data entry. We also captured on that. Those are things that to look out for when you're thinking about data. Inconsistencies in the way data is tracked. For example, monthly wage instead of hourly wage. Sometimes when we look at the employment data, you find $100 per hour, but when you go to look at where the person is working, most probable it wasn't. Or sometimes you find that there are recordings of payment that is below the minimum wage. Then that raises a question: are we getting our clients jobs that are below minimum wage, or what's going on? And I know sometimes it's just a typo, but it's just things to think about when you're looking at data quality and making sure that the data you put in speaks to that. Because, like, for example, when you talk about the hourly wage, for example, and you have inconsistent data, or you have data that is incorrect, when we do the average, then it comes to a very low number. It affects the overall program outcome, right? So when the donor will be looking at it and saying, how comes your average wage was this much? It's because there's a lot of data maybe that was missing or that was entered wrongly that would end up with that. Then client information aligns with project eligibility requirements. I think we've talked about that. If you are over 18, then you can be enrolled in RSS. If you're below 18, then you should not have an enrollment date for RSS or RCA programs. And then now we are going to move on to a group activity so that we can practice how to get the data quality issues. So we're going to go into breakout rooms, and I will share a link I'll share this link on the chat. Sorry. Let me go to the chat. I will share the link in the chat that has the data. sending direct message to one person. It should be to everyone. Let me stop sharing for now so I can get the link that I want to put in the chat that we're going to use. So there's a question in the chat about clients under 18 should not have RSS. What I meant by under 18 is like for RSS services, which is employability services, it's from 18 and above. So if you're 17 and above, maybe you're enrolled in youth mentoring or school impact projects, programs, not RSS.
They can be enrolled in RSS adjustment.
Or the adjustment services. Sorry about that. Okay, so we have the link in the chat, and going back to sharing my screen so that we can look at the directions. Great. So we are looking at, in the link, you will find a data set. I have made it accessible to everyone, and we're going to break you into groups, and you're going to try to see how many data quality issues you can see in that data set within 5 minutes. And then we can come back and discuss how you would address those quality assurance issues. So I'm going to open breakout rooms here. Is everybody clear about the instructions? Or any questions about the instructions? Everyone is clear? Okay, there's a question in the Q&A, but we'll answer when we come back. Let me open the breakout rooms.
Had like a person was a Cuban Haitian parolee, but they're not classified as that status. They, like, let's say the person was from Afghanistan, they would have not been qualified for Cuban Haitian parole and things of that nature.
Yeah.
There are a lot of like US born refugees or Cuban Haitian entrants, which wouldn't be the case.
Breakout room 17 say they found missing zip codes, some in numbers were incorrect. Thanks for sharing. Thank you. I mean, and that's just a simple exercise on how you look at your data. I think I saw some of the data. We have an exemption for 65 and above, but the person's birth date was in 1999. We had an SIV who was from Ethiopia. We had people that their hourly payment was $10 when right now we are earning $14.13 as a minimum wage for New Jersey. So such errors. And when you accustom yourself to looking over the data and trying to pick those points, then it makes how you put your data in better, you know? So you become better at it as you practice to, you know, print out the reports and look at them, what are the errors, and you're able to correct those errors as you go along. So back to yes, thank you, Simon. That's definitely true. This is from the training environment, the data that we provided. We cannot provide, you know, we have to be cognizant of our clients' information, so we cannot share across the board. So we had to come up with data that is fake. So no wonder the names were like Coca-Cola and stuff like that. So yeah, thank you. Thank you for pointing that out. Great. So back to our presentation and just wrapping it up here. Let me see where we are. Can you see my screen?
Yes.
The full screen?
Well,
Okay.
we can actually see your presentation notes.
Oh, how did that happen?
I think up at the top for display settings, you can switch presentation views. It might be hidden underneath the Zoom screen share bar, but it's at the very top that says display settings.
Oh, maybe if I stop to share and start again, I might do a better job, right? Let's try again. Do you have the?
We can see the window of the PowerPoint. Yeah, you're not, yes. And now we see the complete slide using data program success.
Okay, great. So we did the activity. Thank you so much for participating in that activity. And now looking at how to use data for program success. So the reports that we're getting, again, help us to look at the caseload management of our programs. I think we talked about this before: grant writing, having team meetings, gathering data for external presentations, quality assurance, and evaluating our program outcomes. Just a recap on why we need the data to be quality and what we get from the reports once we pull them. Then some best practices to make sure that we are putting in data the right way. So invest in initial and ongoing data training with your team. That's for the managers. And luckily now we have Pauline and Asia who are really active in making sure that we have training across the year. We have open office hours. So if you have any question, please drop in at the office hours. I think they happen monthly so that you can ask your questions there. Become better at it. Quality data entered. Make sure that we have quality data that is entered into client track on a regular basis. Use a buddy system. Have someone to spot check your data. For example, if you're 2 employment specialists, you can have someone look at what you're putting in. Because sometimes when you do something over and over again, you're not able to catch your own mistakes. So having someone look over your data to make sure that it's correct. I mean, and that's what the supervisors will be doing, but even at a personal level, just to make sure that your data is correct, it's a good thing to keep yourself accountable. Then for managers, you can select people on your team who would be responsible for quality assurance of specific data. And that's just spreading the load so that we're not loading up one person with doing everything. We are sharing bits and pieces to make sure that the overall piece of work is perfect and has quality. Then when you're conducting quality assurance, note team-wide areas of improvement, and this goes back to initial and ongoing data entry, right? Training. So once you note there, like, what can I say, trends within your team that are coming up or popping at you, then maybe that's when you say, okay, maybe my team needs training on this particular topic. So it goes back to that. And finally, we have the NJOR client track training calendar that has been shared with all of you in different forums, but just putting it here for all of us to see. We have client track office hours, like I mentioned, and then there are refreshers that happen at different intervals during the year. So familiarize yourself with that, mark it on your calendars, make sure you are able to attend any session that you think would be beneficial for you and your team. Any questions? Okay, does that speak to that everything was perfect? Should I be tapping myself on my shoulder? If there are no questions. Okay, then even if questions arise after this, feel free to reach out to us and ask any questions you have. Like I said, we have Pauline and Asia on our team. They're very helpful. They are willing to answer any client track related questions and provide trainings where necessary. So we are here to support the agencies and to make sure that the data we are receiving as a whole has quality and is shareable. Okay, so thank you. I'll hand it over to Claire, and then we can just in time for a break. But yeah, Claire.
Thank you so much, Veronica, for that amazing presentation, so comprehensive. I hope that you all were able to also benefit from this deep dive into how we work and what's important to us and ORR and how we can really show an impact in our day-to-day work. So we really appreciate it. And luckily, you will also have the recording for you to come back to, as with all our presentations. So we are going to transition now to the next part of our agenda, which is the concurrent sessions. And let me put that in the chat again for you. And as Veronica had mentioned in the beginning, an overview of the sessions that we'll be having. These are all the Zoom links that you can use to access them, just like yesterday, and then a link to the agenda at the bottom. And so we'll give you all, 5 or 6 minutes to take a break, step away, get some water or tea or coffee, and then we will come back to the concurrent sessions at 11 a.m. At 12 p.m., just as a preview, we're going to have the networking if you'd like to join in. So please refer to your agenda for instructions on how to access that. Thank you so much, everyone, and we'll see you in a bit.